Hello everyone, I welcome you all to our first ever episode of Specialties in Medicine podcast, or as we informally know it, the SIM podcast. My name is Justin, and I will be your host today here with our inaugural guest, Dr. Lisa Reid. Dr. Reid is a board-certified surgeon and also an assistant professor of surgery, serving the Camden, New Jersey community and the surrounding South Jersey communities as well. Dr. Reid completed her MD at the University of Medicine and Dentistry of New Jersey, followed by her internship and residency in general surgery at Cooper University Hospital of Camden, New Jersey. She then earned a fellowship at Massachusetts Eye and Ear Infirmary of Harvard University to specialize in thyroid and parathyroid surgery. She has been locally recognized on multiple occasions as a top physician in some of South Jersey's most popular publications. We are incredibly delighted to have you here with us today. Welcome.
Thank you. My pleasure to be here.
Glad we can have you. So to begin, where does the story start? Where and when did you first begin contemplating a career in medicine?
Well, it actually started with my parents, who always wanted me to be a doctor, and they really influenced me to consider that as a career option. It helped that I was interested in and liked the sciences, and then as I had my own experiences with physicians, that really helped develop my interest in going into medicine.
Were your parents in medicine as well?
Neither one of them were.
That's good that they encouraged the sciences.
They did.
And for some of the undergraduate listeners, could you tell us a little bit about your path into medicine and your path into medical school? Did you start out taking science classes, or did you have a different major initially?
Well, I started out and finished as a biology major, but as you know, and your listeners should know, you do not have to be a science major to go into medicine. And actually, students who aren't science majors tend to be more interested into admission committees because they're different than everyone else who's, biology or chemistry majors. But I didn't know anything better, and actually I enjoyed being a biology major. So I was a biology major in undergrad.
Yeah, and that's what we think of as the traditional student, is the typical science major. So once you began medical school, how long did it take you to finally understand which path of medicine you wanted to pursue?
So when I went to medical school at UMD&J, New Jersey Medical School, there was a big push to do primary care medicine, which I thought would be ideal for me. In fact, that's really all I'd been exposed to up until that point, and I thought it would fit my personality. I very soon realized that may not have been the best choice for me, just based on my third-year clerkships. And in fact, it wasn't until I had my last rotation in my third year in surgery that I really felt like I'd found the area where I really would fit in best.
Yeah, and that was your surgery rotation,
surgery,
obviously.
Yes.
Did you realize that you wanted to specialize, or how did that work out with regard to involving surgery? With your surgery interest?
That's the interest. So actually, one of the things that really drew me in was surgical oncology initially, and then also my experience on plastic surgery, which I really enjoyed. And I thought going into residency, I was going to go into plastic surgery. Then the good thing about general surgery residence is you're exposed to a big range of possibilities, and it soon became clear to me that endocrine surgery would be the right niche for me.
Yeah, that's pretty fascinating, because you hear a lot of people that come into school, thinking that they know what they want, and they completely change their mind. Just, it's like you said, until you get exposed, you don't really know what it is that you liked. What changed between the plastic surgery and the endocrine that really got you excited and enthusiastic more about endocrine surgery?
So my initial attraction to plastic surgery was the reconstructive aspects of it. And as a student, you see a very small aspect of it, where it's all the stuff that goes well and you're doing so much, and then you start to see more and you realize there's actually a lot more involved. And so what plastic and reconstructive surgeons do is great, but I realized that probably wasn't the best fit for me anymore. And I will give credit to my program director at the time, who said to me, well, what is it that you really enjoy doing? And he said, which surgery do you like to do the most? And I said, I absolutely love doing the thyroid operations. And he said, well, did you know you could do a fellowship in endocrine surgery? And I had no idea at the time that such a thing existed.
Yeah. So you became very specialized, which is great. So when was it that you made that final decision for being an endocrine surgeon?
That wasn't until my 4th year of my general surgery residency.
Right, so that came much
towards
later.
The end.
Yeah. Okay. And do you feel that you were back to medical school? Do you feel that your decision to pursue surgery was forced at all to decide on which specialty you wanted to go into come residency?
No, I don't think so. I think that there wasn't any, there weren't many options like there are now for integrated programs. So almost everyone who was interested in surgery was doing general surgery. So that made it easy, to go into a broad-based program where you'd be exposed to different things. So I didn't feel pigeonholed in the beginning.
Right. And do you feel like your experiences as a student were enough? They were sufficient to make that decision?
To go into surgery, yes.
Yeah. Okay.
Absolutely. To make a decision about a specialty at the time, probably not.
And that's kind of one of the main reasons that we're making this podcast is because we feel that, that 1 year of exposure that students have really just isn't enough. And we're hoping to get, more of the personal aspect through these interviews. And could you tell us a little bit about how your experiences or influences in medical school helped shape your path towards that surgical residency? Was there one specific patient who, really made a lasting impression on you that you said, wow, like this is, I know you said that there was a specific surgery you enjoyed performing or seeing at the time. And was there something special about the patient population that really drew you to that field?
So to make the decision to go into surgery, I can't tell you there was a groundbreaking moment where there was one, specific surgery or experience, but it was a general feeling I had. So if I had surgery as a last rotation, and I really tried to do what people say at the beginning of the 3rd year and kept an open mind, thinking really I was going to go into primary care. But when I did my primary care rotations, family medicine, it wasn't as intellectually stimulating for me as I wanted it to be. I felt like it was a lot of the same thing, and I felt like I wouldn't be completely fulfilled doing that. When I did internal medicine, it was absolutely intellectually stimulating, but I felt like there was just one step short of what I wanted, what I could accomplish. And I also wasn't a huge fan of the rounds.
Yeah.
I kept thinking on rounds, are we rounding again? Is it over yet? But when I did surgery, in spite of the fact that I had to get there, sometimes at 4:30, 5 in the morning, I'd be there till late at night and overnight too. It never fazed me. I enjoyed it the entire time, and I was excited. I never felt, I did feel tired, but I never felt like I was overwhelmed, and I wanted to go back and see and do more.
Yeah, because that's, I had surgery as my first rotation for 3rd year, and it was just, a shock. It's a whole new world, and it takes a very, dedicated person to really want to pursue that, so much.
Yes, believe me, I tried to talk myself out of it many times.
So there's a myth out there that says if you have any doubts about surgery that you shouldn't pursue it. Do you believe that to be true?
If you have doubt, I would probably say it's true, actually.
Okay.
It's not for everyone. It's a very fulfilling field, but it's very demanding, and it's not one where you're like, well, maybe I like it a little bit. It's a huge commitment, time commitment, physical, mental commitment to get through a surgery residency. So I think if there's any ambiguity, it's probably not the field for you.
Yeah. What do you feel is the most demanding part about it? I know you said that it's physically, mentally, and probably emotionally if you're, away from your family for so many hours, a day or a week, a year. I'm sure that adds up. What do you feel is the most demanding part of the surgical residency?
Of the residency, I would say it's probably the time commitment for a resident, because they work long hours every day. I think on a tendon level, though, it's the emotional stuff. You feel very connected to your patients and very responsible for them. And it's hard sometimes to completely separate that, to go to work, work from whatever hours you're there and then not think about your patients or what might be going on with them when you leave the hospital. Yeah. And, having that on your mind all the time. That's hard to let go of. And I think that is the most difficult part of it.
And I've definitely seen this emotional commitment with you before because I've been in surgeries with you in the past, and I know that you're there from the very beginning, setting up the patient and until they're waking up with anesthesia. Where would you say your commitment comes from? What really drives you? What fuels this commitment that you have to medicine?
I think most surgeons are a little obsessive compulsive, and we're perfectionists, to be honest with you. So we want good outcomes for the patients first and foremost, and certainly for us too. And so that's why I think that even though we know there's demands on you for time and physical demands, that we're willing to do that for that good outcome because we want to see the patients do well.
Yeah, you've definitely invested quite amount of your time and effort in doing all this for society, and it's definitely a strong commitment that people need to consider when going into the surgical field. What do you believe to be unique about the field of surgery that you don't find in other fields?
So, the obvious things we've already spoken about. I think...
Yeah, that's fine.
I have to think, specifically, what's so unique. It's probably just the way we deal with patients. It's very unique, our interaction. So you get to meet someone in the office for a 30-minute visit. And during that visit, you have to go through their history, make sure you either come up with a new diagnosis or verify a diagnosis that comes with the patient from the referring physician. Then decide whether or not this requires surgical treatment, and if it does, to be able to explain it to the patient in terms they can understand what needs to be done. And at the same time, develop a rapport with them that they feel like they can trust you to then operate on you the next time you see them.
Right, that's a big deal for patients because in the outpatient clinic, some people are very scared. To just put it in the most simple terms, that they're going to be, if they're going under general anesthesia, will I wake up? They tend, or from what I've seen, they have a lot of concerns in it. And I commend you for being able to comfort them and build those relationships that have that trust. Because I can see how that's very difficult. And so to the outpatient versus inpatient world, how much time do you spend on each in a week? How do you break that apart, and how do you, like you were telling us the main differences mostly, but how much time do you spend in each?
So my practice is a little bit variable in terms of that. So I see patients in the outpatient clinic 2 days a week. And I operate 2 days a week, and I have my 5th day is my administrative/medical school day. My patients typically that have surgery stay in the hospital for 1 or 2 days. I also take general surgery calls, so I get to see patients in that aspect who have different issues, who end up, already usually in the hospital and will end up staying longer. The difference is, the time you spend with them. With patients you meet in the office, they have a chance to meet you beforehand, establish a rapport, and then have, things done in a relatively elective manner. But patients that you're meeting in the inpatient are already ill and don't really have, as much time to kind of think about what's going on and to assimilate and do elective things. And so it does make for a different interaction.
And with this, how does that differ between, or what is the lifestyle difference with regard to the workday for residents versus attendings?
Well, the great thing is that ACGME has come up with the 80-hour work week, which applies to residents. And so their hours are limited and tracked very well by the residency coordinators and the program directors, and so they're not allowed to work more than 80 hours a week, and so they go home post call. They're can at different levels only work certain amount of hours at a stretch. Like an intern now cannot take overnight call because they're only allowed to work 16 hours at a time. Okay. But beyond, so they can't do a 24-hour shift, but beyond that, the more senior residents start doing that. But that's the difference, is that they are regulated in terms of their work hours, as opposed to an attendant. There was no limit. We take call at night. If you get called in, you have to come in and do your operations. We still have regular day the next day. If you have an office day, you still go see your patients in the office. Right. If you had regularly scheduled cases, you still have those cases to do. Yeah. There's no post-call day for us.
Yeah. I heard recently that they were thinking of changing the extent of hours that an intern can work from 16 to 28. Have you heard this?
I have heard this, but I don't know that it's been approved.
Okay. Yeah. And how do you feel about that with regard to, the patient safety, or, even physician safety, or...
So you're talking to someone who trained prior to the 80-hour work week, who's had many weeks where I worked over, 100 hours a week. So I know it can be done.
Yeah.
But I think if you change that on someone who's already in a residency, who's gotten used to the existing work restrictions, it would be a challenge. Someone coming in new would be fine. I think they would do it, and they would do it well because they know nothing else.
Right.
But if you try to tell one of our interns now we're going to suddenly expand your hours, I think they would struggle with it. Yeah. Because that's what they've gotten used to.
Yeah. It's an extra 12 hours. That's quite a significant difference.
Yes. That being said, though, I will tell you that what I have noticed, though, is that you do lose a little bit, in terms of training when you do have the shorter hours, because you're not seen as much. When you have to leave, you may not be able to participate in a surgery on a patient you admitted the night before because your time is up, right. As opposed to the old system where you would literally see the patient from the ER, admit to the admission, through the surgery and the post-operative care.
And we've been focusing a lot on, the hospital life aspect of this. Mm-hmm. What about the family life aspect? For those who want to do surgery, how have you handled family life, and how would you recommend that other people manage their family life?
Well, I think that's a very individual question.
Right.
I will say, though, that family life is important for your overall health, and so having some balance really makes a difference. I have 2 children, which I had after residency, and that's a question I get a lot from women who want to go into surgery. Should we have kids early in medical school or in residency? And I'm not sure what the right answer is.
Right.
I know that the climate is different. As I mentioned before, I trained prior to the 80-hour work week. So having children while working the schedule I had before would have been very difficult, and it was frowned on. Things have changed.
Yes.
We've actually had several residents in our program who've had 1 or 2 children during their residency. I think it was easier for them to accomplish that because of the 80-hour work week, but they also still had challenges trying to balance residency and having children. And I say that for both the male and female residents. So let me be clear on that, because the male residents have responsibilities also in the family upbringing. So I think it can be done, though, and I actually don't think that having a surgical career means that you can't have a family life or have children. It can be done, but you do have to become very good at balancing things, and you have to be willing to give up certain things, or say it's okay that someone else is raising my child more and spends more time with them than I do some days. So there are days where I leave my house before my kids wake up, and I get home and they're already in bed.
Yeah.
There's more days that are not like that, then those are few and far apart, fortunately, but it happens.
Yeah, that's what we hear a lot in the school, is that it's about sacrifice, because it's not about us. Ultimately, it's about our patients.
Yes.
But from what you're telling me, it seems like we are able to get the best of both worlds, which is good to hear. It's reassuring. What's the most interesting story that you've had, as a surgeon or a resident with regard to a patient, or,
There are lots of good stories.
Yeah.
There's lots of feel-good stories about the patient who you thought was going to die who came through, and there are all the weird stories of all the things that you thought you would never see, and you're seeing it and you can't even believe it's really happening. I can remember, when I was a resident, there was a patient who came in with a ruptured esophagus who was so septic in the ICU, I thought he would never make it through. He was in there for probably about 3 months with a tracheostomy and everything. And it stood out in my mind because I remember the day he was to a point where he could get a tracheostomy that you could talk through, and I showed him how to use it. He immediately said to me, "How the hell do I get out of this place?" And usually people need some therapy to be able to talk again, or you think they may have some cognitive deficits because they've not been able to talk and they've been so sick for so long.
For multiple months.
Yes,
yeah.
And he literally put his hand over the trach and said, "How the hell do I get out of here?" I almost fell on the floor. That guy and a guy I remember on the table one time who was having an elective cardiac surgery who coded as we were getting ready to start before we'd even prepped and draped him. And we literally threw betadine on him, opened his chest, did a successful surgery, and he was extubated and on the floor in 2 days. Those patients are amazing,
That's
and they
incredible.
just do so well. You just can't imagine that that's even possible. And then, there are all the interesting patients that come in with foreign bodies and interesting orifices that you didn't think were possible. Just things to make your day more interesting.
Yeah,
to
sure.
lighten things up a little bit.
Yeah. As students, you don't get to see that much because you're not in the hospital that much. But it sounds, based off your stories, that you genuinely get wonderful feelings when you think about these past stories of helping people. Would you choose surgery again?
Absolutely.
Yes.
Absolutely, without a doubt. It's as challenging as it is to, to do the time commitment and to take time away from your family. The appreciation you get from your patients is more than worth it. It's fulfilling as a technician to be able to do the surgeries, but also when your patients are so grateful for what you do for them, and also seeing them get better, from being ill and being able to say to them, your cancer is cured, your tumor is gone. It's very fulfilling. And so I would absolutely choose it again.
Yeah, I'm glad to hear that. For those applying to surgery residencies currently, what do you feel is one thing that you wish you had known before you applied to surgery that people hadn't told you, or that you hadn't figured out until later on when you were in surgical residency?
I think I'm going to expand on that a little bit and say I wish I had been exposed prior to going into general surgery in some of the surgical subspecialties that have different tracks.
Okay.
And I think that's difficult to do because those aren't offered in the third year. But there's a lot of them that are very appealing, or can be very appealing to certain students, but unless you know about them, wouldn't know to even ask to do a rotation. And some of those include ENT, urology, ophthalmology, which I think are really good specialties that offer a lot that we don't really know very much about in the third year. And you really have to know those early to be able to make a decision to apply to those. I think they offer a lot because they are pretty broad in their range, especially things like ENT. You see pediatrics, you see pediatric populations, you see adults, and the range of what they do is pretty neat.
Yeah.
So that's one thing I wish I had been exposed to more. In terms of general surgery itself, I think that it probably isn't anything that I didn't know going in.
Yeah, so
I think I knew it was going to be pretty intense because of my experience with my mentors in medical school. I kind of had an idea, how intense and how involved it would be. I think what's changed, though, is how much how physicians are viewed has changed, and in terms of how we are compensated. Maybe there is something I should touch on there. Is I didn't realize how much of the other stuff would affect me. Like, I thought I would just go to work, and actually this is a good point, that I would just be a surgeon, I would see patients, I would take care of them, and that would be it. Then there's all this other administrative stuff that comes into play. Learning how to do billing, learn how to deal with your administrative staff,
Coding,
and with the
yeah.
hospital staff. That's something I don't think you really appreciate as a student.
Right.
That can actually make or break your job or your practice, to be honest with you. It really can.
Yeah, and it seems like which is tough because we don't get a lot of exposure to that, as students. And it seems like one of the main differences is that 80-hour work week, limit. Where do you see the field going in 10 years with regard to, do you think the hours will get expanded back again, perhaps, or just in general, where do you see the field of surgery going with regard to residency?
Well, with regard to residency, I'm not sure that they're going to be able to go back on the 80-hour work week.
Okay.
I don't know that there was ever any good data to begin with to show that an 80-hour work week would make surgery residency safer. So I think it will be hard, in spite of that, to go back to the old way of, having more than 80 hours. I think what will be possible is that the residencies may be longer in order for people to feel they're as competent as they were before when they worked longer hours.
And how about for the attending surgeons like you? How do you feel the field may change in 10 or so years?
I'm not really sure. I think that there is an opportunity for people to become more shift workers or more of a hospitalist type program, and there are places where they're starting to do that. I think those will crop up more as people are looking for more lifestyle type practices, because now they've done 80-hour residencies. It's hard to make that transition then to an attendant where you're not restricted by the hours. And I think some of the surgical hospitalist type programs where there's restricted hours, where you're working shifts, is becoming more appealing to some of the people coming out of training at this point.
Yeah, for sure. So as we wrap up this discussion here, it would be incredibly helpful to tap into your wisdom one last time on air. What would your final advice be for students interested in pursuing a residency in surgery?
I would say that you should not be deterred by all the naysayers who say, why would you want to do that? It's so hard and it's such a long road. I would say if that's your passion, that you should go for it. Someone told me when I was in medical school, are you going to want to do something that's easy or something that you're going to be excited about going to do every day and be able to do every day for the rest of your life? And to me, that made the decision easy. I was excited more about surgery than anything else, and I couldn't imagine that even though there was an easier road, that it would be any more fulfilling. So I would say follow your dream if that's what you want to do. But be a realist about what it will involve. It's definitely not going to be a 9-to-5 job. You'll be working nights and weekends, but a lot of other people do that, and a lot of other specialties do. But the extra satisfaction you get from being able to really treat people on an urgent basis and really see a quick, resolution to the issue is more than worth it.
Well, I'd like to thank you again for being our, first ever guest on Specialties in Medicine. We really appreciate you sharing your journey through medicine with us. It's been very informative, and learning about the ins and outs of what it's like to be a surgeon every day, because some may not really be exposed to that early on, and you're really helping us provide a service to the medical student community to show the more personal side of medicine. And I'd like to thank you again for being here with us.
You're welcome.
At this time, I would like to introduce you to my colleague Kyle, who will tell us some facts about surgery. Welcome, Kyle.
Thanks for having me, Justin. That was a very informative and interesting interview you had with Dr. Reid. You can hear why she chose surgery. It sounds very rewarding. But before becoming a surgeon, medical students have some hills to climb. According to a 2016 MATCH data from the National Resident Matching Program, the average USMLE Step 1 score for U.S. students who matched into surgery was 235, just above the overall national average Step 1 score of 230. And to add a little bit more context to that score, a U.S. graduate has a 220 Step 1 score. They had about 80% chance of matching into a surgery program. And for those taking the COMLEX Level 1, the average was 609.
Let's not forget about our friends who attend schools outside of the U.S. For U.S. international medical graduates, the average Step 1 score for matched applicants was 239.
Justin, what about Step 2?
Well, for Step 2, U.S. seniors had a score of 247. U.S. international graduates had a score of 243. And for osteopathic students, they had a COMLEX Level 2 score of 618.
Another important aspect for applicants to consider is the amount of research needed. The mean number of abstracts, presentations, and publications was 4.7 for matched U.S. students. 370 matched students had 5 or more publications.
Really? That's pretty amazing.
But listeners, don't be discouraged. 84 students had no publications and still matched to a surgery program. Also, surgery was near the national average across all specialties for volunteer experiences at 6.8. Overall, 1,081 U.S. seniors applied for general surgery and 897 matched, for an 83% match rate. For U.S. IMGs, it's a little bit more bleak. Only 32% matched, one of the lowest match rates for any specialty.
Make sure you study early and study often. So Kyle, once you make it to residency, what should one expect?
Well, training consists of 5 years of postgraduate education. Some programs may be 4 years and other may be 6 years if they add in a research year. Although the day in, day out grind of a surgical resident's life can be varied depending on which program you enter, there are some common features inherent in all surgical residents' daily schedules. According to the 2015 data from Frida Online, the average amount of resident work hours per week was 74. That's only second to neurosurgery. One interesting statistic is that 75% of residents are pursuing more training post-residency. It seems that fellowship is a must after residency ends, adding even more years before one is a full-fledged attending.
But Kyle, what about the compensation for this?
Well, according to the Medscape's 2016 Physician Compensation Report, general surgeons make an average $322,000, and it only goes up if one is fellowship trained.
I always say that compensation shouldn't be the determining factor in choosing your specialty. One must look at satisfaction as well. What is the satisfaction rate among surgeons, Kyle?
Well, according to the same report, 51% of surgeons said they would choose surgery again as a specialty. That number puts them around the middle of the pack for all specialties. Let me add that the Medscape Lifestyle Report has surgeons in the top half of physicians who are the happiest at work. I think we heard that happiness and passion today from Dr. Reid.
Yes, I definitely heard it as well. I'd like to thank Dr. Reid again for being our inaugural guest. Along with the facts we just gave you, we hope that we've provided insight and a personal account of what it's like to be a surgeon. This is Justin
And Kyle.
signing off, and thank you for joining us for Specialties in Medicine podcast.